About 7 years ago here at IGHL, we realized our healthcare costs were rising astronomically. We were forced with the choice of whether to increase our employee contribution or to do something drastically different. We decided that we would implement an agency-wide wellness program for our 1,600 employees here at IGHL, and that wellness program we call Health is Wealth. I want to tell you guys a little bit about Health is Wealth, but I'm going to go back to the beginning and go through some of the research and analysis that led us to the decision to implement Health is Wealth throughout IGHL. We realized that it was no longer good enough to make plan design changes. We wanted to address the core of what was affecting the health of our employees and to try and get them to live a healthier lifestyle and to change their behaviors to healthy ones, quit smoking, and I'll get into that later on. We also wanted to reward employees, to come up with a system to reward our employees for participation in the program. The annual cost of unhealthy lifestyle in the United States is in the billions of dollars. Now this is according to some research that Aetna did for us. And you can see the top 6 causes of unhealthy living: obesity, smoking, hypertension, diabetes, stress, and inactivity. Now, Health is Wealth is designed to address each one of these areas. As you can see, IGHL employees have a higher rate of many of these different unhealthy areas, as opposed to all the other members within the overall Aetna health care industry. The majority of our employees, unfortunately, now to remind you, this is going back 7 years, we've changed a lot since then. Many of our employees smoked, many of them were obese, and many of them, because of the nature of what we do, had difficulty in how to manage their stress. IGHL, per 1,000 members, had 117 admissions for inpatient care at the hospital, as opposed to 85 for Aetna, so we're well above Aetna's average. In the days per 1,000 employees of inpatient care, it's 517 for IGHL, as opposed to 299 for all other Aetna members. We wanted to promote personal responsibility for health and well-being, keep healthy people healthy, aid to be in an effort to be the employer of choice. Health is Wealth is really one of those benefits that make us stand out, because we're one of very few organizations on Long Island that have a program like this. We wanted to enhance productivity, reduce absenteeism, and keep people working. Over the past 7 years, we've seen a significant reduction in the use of sick time, and obviously we wanted to manage our medical costs. The program, like I said, began 7 years ago. We identified these following target areas in the first go-around for Health is Wealth. We wanted to make people aware of their own health, so we created a health risk assessment. Our employees could go online, they can complete a checkbox, and we asked them to be honest about it. Do you smoke? Yes. How much do you drink? Be honest about all those answers, so we can accurately self-assess each employee. We really wanted to hit on tobacco use, which is a big issue here at IGHL. We're hoping by 2014 to be a totally smoke-free campus. That's one of our goals, and we've come a long way. We've helped a lot of people to quit smoking. Nutrition, we offer many different nutrition classes. We wanted to address the nutrition issue because many IGHL employees are extremely obese. So we tried to implement contests and other things to try and get that down. And we also started our own fitness program, which began with the opening of our very own fitness center here in this building in the basement that's open to all employees free of charge. The health risk assessment, like I said, is an online health risk questionnaire, and it's regarding the employee's lifestyle and their health. It's tailored with suggested steps to improvement, and we do follow up with that as well. And it also helps people get into the Aetna disease management programs that they have available. We have implemented a 6-week smoking cessation class not only for smokers, but also, other types of tobacco. We also implemented our fitness and our nutrition program, where employees are required to take 4 1.5-hour nutrition classes that deal with everything from, what not to buy at the supermarket, what not to cook with, how to manage stress, personal finances, all those things that go into making somebody healthy. And we also require that every employee complete 4 hours of fitness in the gym. We've actually increased that since the beginning of the program. We wanted to kind of start slow and not hurt anybody and get people active and moving again. These are our critical success factors. Management support. That's from the executive level all the way down. Everybody had to buy into this. It was a culture change for IGHL. It wasn't easy at first, but 7 years later, everybody's doing it, and there's a lot of excitement about it. We've also incorporated this part of our overall health strategy for the agency in terms of monitoring and seeing the different trends in diseases that we've seen over the past few years. Communication, just like anything else. I know this is a communications class, so we do a lot of newsletters, face-to-face interaction. Our fitness instructors are extremely active and work one-on-one with the employees to develop fitness programs, not only that they can employ here while they're on site, but also at home as well. And we use incentives a lot. Financial incentives for our employees seem to work. Our employees don't make a lot of money, so we try to give out prizes and financial incentives for people beyond the reduction in their employee contribution. The more an employee participates in Health is Wealth, the lower their contribution is. Everyone can benefit from the Health is Wealth program. It's a great program. Like I said, it's just a win-win situation for us. The employees get healthy. I think the first year we ran our biggest loser contest, and we lost over 1,000 pounds collectively. For the winning team, I think each team member got $2,500. So there was a pretty significant incentive. Employees, as I said, could save money on their medical contributions, but also the smokers. Here in New York, a pack of cigarettes costs $11 a pack. So if you're a 2-pack-a-day smoker, that's $22 a day. And our employees realize very quickly how much money they can save by not smoking, not only on cigarettes, but on trips to the doctors. And we've already seen a long-term impact for the agency. We've managed to reduce our annual healthcare costs by over $1 million, which is pretty significant for a not-for-profit. The Health is Wealth program is voluntary, and that's where the use of incentives come in. Participate as much as they can. All programs are provided at no cost to the employee, which is kind of a great deal because a lot of companies that do have fitness centers still charge employees to use it. But the participation does need to be done on the employee's own time. We've involved our employees at every level of Health is Wealth. We've done a t-shirt contest, logo contest, the mission statement we had a contest for. Every aspect of Health is Wealth, we've run contests and provided prizes and financial incentives for. Short-term, Health is Wealth really, we knew going into it, wasn't going to have an impact. And we knew it would take years to really have an impact. So the first 3 or 4 years, I would say, the impact to the agency, other than the culture change, was not significant. But now we're really starting to realize a return on our investment, because as I said earlier, we're saving over $1 million a year, and I'm sure that's going to grow as we continue to get healthier and healthier. Any questions?